Each year, millions of school and work days are missed because of colds and flu. Both are respiratory illnesses, but different viruses cause them. Since these diseases share many of the same symptoms, they're sometimes hard to tell apart.
I'm calling in sick today. I think I have the flu.
Nonetheless, in order to successfully treat your condition, it's important to determine which illness is affecting you. If the flu is misdiagnosed as a bad cold, potentially life-threatening flu complications like pneumonia may be overlooked. In the following video, you will learn how to better tell colds and flu apart, as well as what can be done to prevent and treat them. The flu, also called influenza, is generally worse than the common cold. Symptoms such as fever, body aches, extreme tiredness, and a dry cough are common and are usually more intense than a cold. Coughing can be a sign of either a cold or the flu, but a bad cough usually points to the flu. Colds, on the other hand, are usually milder than the flu. When you have a cold, you're more likely to have a runny or stuffy nose. Colds generally do not result in serious health problems. However, the flu can result in pneumonia, bacterial infections, or hospitalizations. When you have a cold or flu, there are some simple things you can do to help yourself feel better. Get plenty of rest, drink plenty of fluids, and use a humidifier wherever possible. Taking non-prescription cold and cough medicine may help as well, but always check the label for important health information. As you do, make sure that you choose the right medicine for your symptoms. For example, if you want to clear a stuffy nose, choose a medicine with a nasal decongestant. To loosen up a cough, you'll want an expectorant, but to quiet a cough, you should get a cough suppressant. As you talk with your doctor about medications, remember that antibiotics won't work against cold and flu germs. And when choosing medicine for children or teens, remember not to give them aspirin or other salicylates for cold or flu symptoms. This can result in a rare but dangerous condition called Rye syndrome. When you first have signs of a cold or flu, you don't necessarily need to call your doctor right away. However, you should call your doctor if your symptoms get worse or if your symptoms last a long time. A typical cold should last only a few days to a week. Tiredness from the average flu may continue for several weeks. You should also call the doctor if, after feeling a bit better, you develop more serious symptoms, such as feeling sick to your stomach, vomiting, high fever, shaking, chills, chest pain, or coughing with thick yellow-green mucus. Of course, the best line of defense against cold and flu viruses is to try to avoid them in the first place. You can do this by practicing the following suggestions. Wash your hands often. Cold germs are easily transferred through a handshake or by touching doorknobs and handrails. Avoid people with colds or the flu when possible. If you need to sneeze or cough, use a tissue and then throw it away. Clean surfaces you touch with a germ-killing disinfectant. And don't touch your nose, eyes, or mouth. Germs often enter your body through these areas. If you are concerned about getting the flu, you may also want to consider getting a flu shot. A flu shot can significantly reduce your risk of getting the flu. Because most people get the flu in winter, most flu shots are given in the fall. The shot cannot cause the flu. However, you may feel sore, weak, or have a fever for a few days. Flu shots are most important for people 65 or older, nursing home patients, people over 6 months old with health problems such as asthma, or with long-term diseases such as HIV or heart disease, children or teenagers who must often take aspirin, and people who are often around older people or those with health problems. If you do not fit into one of these categories, you can still get a flu shot to reduce your risk. However, talk to your doctor before you get the shot. If you have certain allergies, especially to eggs, have an illness such as pneumonia, have a high fever, or if you're pregnant. If you are someone who cannot get a flu shot, you should ask your doctor about prescription medicine to help prevent flu. Even after getting the flu, taking this medicine within the first 48 hours can make your illness less serious. While there is currently no cure for the common cold or the flu, you can greatly reduce your chances of getting these common illnesses. If you do get sick, the health tips you've learned here should help you get back on your feet soon.